We must start listening to each other. It is the best way to convince somebody is to just hear them. When people feel heard, then they can move. So that is our final word on that. Now what we're going to do is meet our doctors. So we're going to start on that end over there, and they're going to try in a very kind of concise way to tell you why they're here and why they're mad as hell.
Hi, I'm Catherine Ottaway. I'm a family practice doc and I'm a mad as hell doctor. I do family practice in a small town in Washington State, town of 9,000 people. I still deliver babies and I take care of people from birth. My oldest patient was 104. I'm mad as hell because my patients are calling and saying, please refill my medicines. And I say, I haven't seen you for a year. And they say, well, I lost my job or I lost my health insurance. I can't afford to come in. I can't afford my medicines. I'm mad as hell that that situation is going on. Coming here, this is our 5th day on the road, and I look at our highways and the rest stops. We take better care of our cars than we do of our citizens. I want my healthcare dollars to go to help, not into the pockets of insurance CEOs. When I hear that an insurance CEO is taking home $14 million, then I know he's doing it because they are earning money from our help. Our healthcare dollars are going into their pocket. Our help is our wealth in this country, and it's what allows us to work and what allows us to be productive. And I want the money spent for help, not for profit. That's why I'm mad as hell.
I'm Paul Hochfeld, and I'm mad as hell. I'm an emergency physician, 30 years in Corvallis. And what I'm mad about is actually less about healthcare than our political process. It's been once again hijacked by the industry to manipulate public policy for profits instead of public good. We're spending too much money on healthcare already, twice as much as the rest of the world. We're getting bad results because of the perverse incentives that's built into this for-profit system, or non-system. It's not really a system. We've got people suffering because they're getting too much care. Too many drugs, too many interventions, too many physicians, and we're all paying for it. On the other end, we've got people that aren't getting the care that they need. They're suffering because of it, and then when they get really sick, we all pay for it anyway. And our congressmen know this, congressmen and congresswomen know this. And at some level, they understand that the only way we're going to afford the moral imperative of universal access is by saving 20% right off the top by getting rid of the insurance companies. And it's like, duh, you know? And the only reason we're not getting it is they think they need industry money to run inane media ads in the next round of elections more than they need your support. And that's what I'm mad about.
I'm Dr. Joe Eusterman. I started my private practice in internal medicine over 50 years ago. I retired 2 years ago. The first 22 years of my practice was internal medicine, private practice. The last 28 years was in occupational medicine, taking care of injured workers, workers who were made ill on the job, by their job. In a 50-year time span, we got mad as hell about a lot of things. And you get mad as hell, particularly about a lot of things in our broken system. As my colleague Paul says, you have no idea how badly broken our system is. You have no idea. Now, in 50 years, as I said, you get mad about a lot of things, but I've had to discipline myself for this presentation because I would go on and on and on and on. So I wrote out why I'm mad as hell here. You're going to have to just indulge me while I read it to you. Otherwise, I would never be off this microphone. I'm mad as hell about the lies and the fear-mongering. They're being used by the status quo sociopaths to keep every American from having guaranteed access to quality care simply by each of us paying only our fair share. Americans have enough worries and fears without more being laid on them by the swift voters and others of that ilk. That's why I'm at this help. Thank you.
My name is Tim Jordan. I'm a developmental pediatrician. I have a private practice in Phoenix, Arizona. I joined the Maddis Health Doctors in Idaho, and I'll be joining them for a little while to give my what little support I can to them. I've spent most of my life working with kids who are in low-income rural areas, don't have much access to care. And what I don't like about our system is that it's always the care for low-income kids that gets cut when anybody decides to cut something, and nobody pays any attention to it. The last several years of the Bush administration, they cut funding for the Indian Health Service. They refused to add a few thousand kids to the Medicaid rolls in the last year that famously got very little attention. But if we had a system that provided the same level of care to everybody, you can imagine all those soccer moms, how they wouldn't let them dare touch our system. But the way it is now, whenever they want to cut something, they always do it for low-income people and kids. So that's the main reason I'm joining this